one of the initiatives I know that you're a big advocate for and that we do at NYU is Kangaroo Care.
Yeah.
Can you explain to the audience what Kangaroo Care means and why is it so important? Some of the research behind it.
Thank you. I'm a big proponent. So Kangaroo Care is when you put the baby skin to skin on one of the parents. So they undress the baby. If they have any clothes on, parents like usually wear some kind of clothing that they can open, button down shirt, and then you lean back, you put your baby right in your chest, and you put a blanket over and you just chill there. And this was actually first invented in, I believe, South America. So necessity is the mother of invention. We have incubators that keep the babies warm. They cost as much as like a car. So I think it was Colombia. I hope I don't get this wrong. But they didn't have a lot of incubators, and they're like, well, the mom is warm and they're there all the time. So they put the babies on the moms. It turns out they do as good or better. Like they calm down, their heart rates are calm, they have fewer like episodes of instability. They're just better. They grow better. So there's a lot of research that shows there's benefit to doing that. But in the modern ICU, we have plenty of incubators. That's not like a shortage. So we don't have a need to do that. But people look at that data and they're like, oh, maybe there are other benefits, like bonding, being close to your kid, family-centered care. So, at our hospital, we actually innovated and were like huge proponents and really brought a lot of Kangaroo Care to America. And with time, things like, new staff, this and that, like the numbers have kind of dropped, and we were like, hey, this is something we should really be doing. Yeah. So we put together a team, and we've been working really, really hard to do it. And for some of our patients, it's easier than others.
Yeah.
Like if you're breathing, you don't need any breathing support, and you're pretty big, preemie, you just have some like less acute or smaller problems, like you're learning to eat or something, but you're otherwise breathing okay, you can go to the chest, no problem. But we have patients who are ventilator dependent. They got a tube in their windpipe. They're like, the machine's breathing for them. If that tube comes out, that's like their lifeline. That's the only thing that's keeping them alive. But, so we're like, how can we also Kangaroo Care those kids? And
that's when they scream, Paige Jonathan.
Yeah. We need Jonathan for this. And so, there have been some bumps in the road, and we're trying to do it. And we've finally gotten to the point where we have like a really good protocol, and, we've had some success. And it's been, imagine a parent who's never held their kid.
Yeah.
Ever. And you have like a 3-month-old. Never held their kid.
At first, I thought you guys was crazy.
Yeah.
And you guys start telling me to take kids with tubes in them and let the mother hold it. And everybody's staring at me, and I'm like, Yeah. But now, like, you really see the difference. Like, talking to the parents, and it's like, that was everything for me, Jonathan. I haven't held my baby 6 months. He's just been in the bed.
Yeah.
And even the babies, it's important. And it's just, once you have check and balances and a strong team behind it, anything can be done.
Teamwork, man. Teamwork.
Yeah.
Yeah, and like I said, like the whole separation. Somebody said this that like separating from your parent is like the most traumatic thing a baby can go. Any mammal.
Yeah.
Like parents and babies are together. They breastfeed. They do that. They're always together, right? Like kangaroos are in the pouch. Like all the babies are like like that. So you separate them out of necessity. Like we got to save their life, help them breathe, give them fluid, do that, all these things, whatever. But then, we never put them back together. And Kangaroo Care is a way to put them back together. And so I think that's like a beautiful thing, and it's something that we've worked really hard to really raise the rates of it. We just showed the graph today at our meeting. I was like, look at that number. It's so cool. It's awesome. Yeah. So proud of our team and everything we were able to achieve. And, even the hardest cases, we're able to get them to do some Kangaroo Care. That is I think the cure for some of that stress that I feel other times, and helplessness when you're not able to fix the thing you want. You have a win, like a parent who's hadn't held their kid yet gets to, something like that. It really balances out the bad feelings.
Yeah, that's amazing.